Hi, my name is Sanvi. Today we're going to be speaking with Mrs. Anokhi Shah. Mrs. Shah attended the BSMD program at Drexel University. She then completed her internal medicine primary care residency at the George Washington University in Washington, D.C. Now she is a physician of internal medicine at Robert Wood Johnson Barnabas Health in Livingston, New Jersey. She is also the clinical assistant professor of medicine in the George Washington Medical Faculty Associates. So, Mrs. Shah, thank you so much for sitting down with me today. How are you?
Good. How are you? Thanks for
I'm good.
inviting me.
Thank you so much for sitting down with us and sharing your advice. We're really grateful for it. So, first of all, did you already know in high school that you wanted to pursue medicine?
Yes, I did. I knew early. I always enjoyed my science classes, my health classes, and I wanted to use that knowledge, apply it to helping people stay well and achieve their health goals. And so, yes, I knew very early on.
Got it. And aside from those classes, did you do any other extracurriculars, clubs, internships that helped you decide for sure?
Yeah, I did a lot of extracurriculars in high school. Some of them were volunteering at, assisted living homes. Others were involved in fundraising. One, I worked at a doctor's office. So there were a lot of varied experiences that kind of solidified that that's what I wanted to do.
Got it. And after high school, what made you choose the Drexel BSMD program?
So I was interviewing at a lot of different programs. I interviewed in high school for medical school, and there are several different BSMD programs, combined undergraduate and medical school programs all over the East Coast. I was mainly looking in the East Coast, and when I did my Drexel interview, I just felt at home with the faculty I met, with the students I met, and I knew that a lot of the programs have similar offerings. I mean, some are definitely better than others, sure. You want to feel comfortable with who you study with and learn from, and I felt that was the case there, and that we could have open communication, and I'd feel comfortable, and that's actually how it ended up being. So I was very grateful for
Mhm.
that.
Yeah, that's great. So you liked your experience there. That's really good. But what kind of extracurriculars were you involved in college?
So then, again, it was varied. I love fundraising, so I continued that for pediatric AIDS, and I did some research in HIV, and then some volunteering here and there in the community. But I really did take the time to also enjoy the undergraduate experience and take it easy. I didn't, fill my schedule every single day, so I felt overwhelmed. That's something definitely happy I did. At the time, I was worried, am I not doing enough? But it is enough. And as long as you're trying new experiences and, exploring different opportunities, then that's okay.
Mhm. Yeah, that makes sense. So going back to your BSMD program in general, do you think it's more beneficial to do an accelerated 7 or 8 year med program versus applying to med school separately?
So I don't think there's a right answer
Mhm.
for every person. One may be better than the other. The reason I picked the 7 year program is because I felt very strongly that of having a career in medicine, and I knew that to become a doctor, it takes many years, even after school, with residency and fellowship, to finally get to where you want to be. So shaving that 1 year off meant a lot to me, especially as a woman who may want to have kids and a family. Careers keep you busy. And so, I wanted to finish school sooner rather than later.
Mhm.
Um, but it does lock you into that medical school, and some people may want to take more time to decide what they want.
Mhm.
So 8 year program may be better, or no program, just a good undergraduate school, and taking good courses there, and then applying to medical school later may be better for some people. It does give you more opportunities, but I thought that for me, the 7 year program was okay.
Mhm.
But I don't think there's a right answer.
Got it. And did you at any point second guess yourself throughout the 7 years?
Oh yeah, for
Mhm.
sure. I mean, there's a lot of studying that goes on, and I was constantly thinking, like, do I want to study this much my entire life? It's a lot of work, and
Yeah.
you know, no matter what you do, you're gonna work hard. So as long as you enjoy what you're doing, and you are looking forward to that end goal, you can get through anything. And so, yeah, I did second guess myself a lot, and I think that's normal.
Mhm. That makes sense. So when did you choose internal medicine and what made you choose that field?
So I chose internal medicine towards the end of medical school. So in medical school, usually the first couple of years you study through reading and lectures, and then usually about the second half of medical school, you actually go to the hospital or clinics and shadow physicians, see what they do, and learn that way. And when it got to the second year, where we were shadowing different physicians, that's when I liked internal medicine, because it was every day was an interesting day because you never knew what to expect. Internists do a little bit of everything, so everyone comes to you for really anything. So, in that respect, it was fun, and I never have a boring day.
Mhm. That's good. And you did your residency at George Washington University, so what made you choose that program over the other ones that you were considering?
So that one specifically, it was a internal medicine residency for primary care, and I knew that's the ultimate career I wanted to do. So within internal medicine, you can primarily work in the hospital, you can do urgent care, you can specialize after internal medicine, or you can become a general primary care provider. And I knew that's the latter is what I wanted to do. So I was looking specifically for primary care programs, and there's not too many, but there are several, and I ended up liking uh, George Washington's the best.
Mhm. Did you like going to school in DC? Like, did that help at all? Was there anything unique about it?
Yes, there was a lot of opportunities in DC. There's a couple different programs, especially if you're interested in, um, you know, things outside of the traditional doctor route. If you're
Mhm,
interested in public health, in DC, there's a lot of opportunity. We were in a health fellowship program where we went to different think tanks around DC. So we got to hear different opinions on, important medical issues.
mhm,
Um, my husband, who was also happened to be in the program, um, ended up meeting the Surgeon General and had a conversation with him.
mhm.
So just being in DC, it opens up a lot of doors, and that was really nice to have.
Yeah, I'm sure. So now you're a physician and then also an assistant professor. So how do you balance those two roles?
So it's not easy. I think what's worked well for me is setting time aside for each role, kind of compartmentalizing it and saying, okay, this week I'm going to spend 2 hours, say Tuesday morning, with academic pursuits or research. And, you know, the remaining time, the free time I have, I can dedicate to it, but I'm at least going to spend this much time towards it this week.
Mhm,
So that you have a set goal, you don't spend too much time, but then,
mhm,
you don't just blow it off. So I think that helps me balance it.
mhm. What does an average work week look like? Hours, shifts at the hospital?
So, it depends. My role has changed quite a bit. Right now, I'm doing 100% outpatient, meaning only in the clinic, not in the hospital work.
Mhm,
So, typically for a primary care doctor, full time can mean you're seeing patients from anywhere from 32 to 38 hours, primarily because there's a lot of administrative work that you need to do after hours that take
mhm,
up the rest of the time of the week.
mhm,
So usually work between 40 and 50 hours a week.
mhm,
And it's very adjustable. But that for the full-time job, it's typically that many hours a week, and it's seeing patients day in, day out. And then, you usually have either half a day or a day to do paperwork.
mm. That sounds fun. Um, So looking at those shifts, how's your work-life balance? How do you juggle being a physician with having a family?
Sure. It's not easy, and my husband's also a primary care doctor, so we have pretty
Mm,
hectic schedules. We have a daughter who's almost 2, but we kind of staggered our schedules so that we're both home half a day every most days of the week.
mhm,
One of us will, so we can kind of take care of her and her needs and be there for her, but then also still have both have full-time jobs.
mhm. Yeah. Sounds really hard, but are you able to get time off if you need to?
Yes, absolutely. It and then time amount of time you want to take off is variable, and a lot of times it's negotiable.
Mhm.
For the jobs I've interviewed at, it's anywhere between 3 and 5 weeks.
Okay.
Um, Depends.
Mhm.
Um, I would say most employers are, well, I wouldn't say most, but, I'm lucky to have the majority of my employers, be very lenient and considerate of family life and
Mhm.
when emergencies come up to take the time off.
Yeah, that's good. So what are some of your favorite aspects about your job?
So I would say for primary care, it's just doing things as a team, you
Mhm,
know, not just me who's responsible for my patient getting better. It's, the medical assistant and, my colleagues who I may consult, or it's the pharmacist who helps me out with one of their medications. So, I think every day we're working together as a group, and that's really satisfying at the end of the day to kind
mm,
of see what accomplished, but we only could have done it together. And you spend a lot of time at work, right? So it's nice to have a group of people who you trust and work
mhm.
well with, and your second family away from home.
Yeah.
So I would that's my favorite part of going to work every day.
Mhm. Yeah, that sounds nice. Looking back on your journey, would you have done anything differently?
I guess, even though I don't regret the 7-year program, I may have considered taking more time off between undergrad and medical school.
Mm,
Um, it's just a time in your life that you have more time, and
mhm,
less obligations and more freedom to do certain things. And so maybe I would have taken a little bit more time off, or maybe I would have taken just a semester off in undergrad
mhm,
to do and I think it's important, even, any career change as you change from, a different school or a different career, or different training process, it's important if you can to take the time off, because taking a big chunk of time off, it doesn't come often, that opportunity, right? Even when you're working, you have vacation, but they're
mm.
usually set vacations. So to take a
Yeah.
long time off, usually when you're transitioning. So I would say, looking back, if I could do more of that, I would have done that.
Mhm. So taking time off, like, would you have traveled and taken extra classes? Like, what do you think you would have used that to pursue?
I think I would have traveled more,
Mhm,
maybe pursue certain interest, playing an instrument, something that I wouldn't normally do. Because I think, especially when you're trying to do a career in medicine, you're always focused on the extracurriculars that are going to get you into medical school, or that are
mhm.
going to get you into residency. And we
Yeah.
don't always take the time to actually, think are actually a lot of fun.
Mhm,
And so, setting aside that time for yourself, I think would have been important.
mhm. Quick sidetrack, in BSMD, like in an accelerated 7-year med program, are you able to study abroad for a semester in undergrad years?
Can. You
Okay.
absolutely can. It was something that was offered to us. I cannot recall why I did not do it, but the timing has to be a little more specific when you're in the BSMD program.
Mhm.
You have to meet certain prerequisites before you graduate, and you need to do it in a timely way. So,
Right.
not all study abroad programs may necessarily have all the prerequisites, but it was certainly an opportunity we could have had if we wanted to.
Got it. Okay. And the last thing is, what are 3 pieces of advice you would give to high school students looking to study medicine?
So I would say work hard. Even though you think that you don't have time now, you will have less time as you get older.
Mhm,
Guarantee. Think you don't have time now, and you'll look back on this time and saying, "Oh my goodness." So put in the effort now. It
mhm,
will definitely pay off. Um, three pieces of advice. The second one, I would say, take the time to talk to people who are doing the jobs you're interested and ask them about their careers,
Mhm.
because sometimes what you study is not actually what the job is like, you know? I'll say I studied a lot of organic chemistry in school and I thankfully used none of it. So,
Mhm.
if I had to use that every day, I probably wouldn't be in medicine.
Mhm.
So just kind of keep that in mind. Um, and I would say my third piece of advice would be flexible.
Mm.
Even though it's stressful to find out what you want to do, it can be exciting. New opportunities can be fun, and just be open to
Mhm.
exploring them because you never know what's going to land in your lap or what will surprise you. You may like something you never thought you would. So
Mhm.
just be flexible and open minded.
Yeah, that makes sense. Well, thank you so much. Your advice was really helpful. Do you have any other thoughts to share?
No, this was wonderful. Thank you for inviting me.
Of course. Thank you so much for your experiences.